What can I do about a slightly drooping eyelid?
Eyelid ptosis, or drooping of the upper eyelids, is a condition that you can be born with or can develop later in life. Eyelid ptosis is typically related to a muscle that lifts the upper eyelid called the levator muscle, which is spelled like the word elevator without the letter E. The strategy used to treat eyelid ptosis is based on the level of severity designated by gradations from mild to severe. The other variable used is the relative strength of the levator muscle, which ranges from poor to good. I routinely treat people with mild ptosis with good levator function, which is oftentimes unrecognized during consultations for cosmetic upper eyelid blepharoplasty. I often see people who had their upper eyelid hooding addressed by a colleague without recognizing the presence of ptosis. This oftentimes results in the patient wondering why they still look tired although they had cosmetic upper eyelid surgery. Whether you're having a cosmetic upper eyelid blepharoplasty or you've become aware that one or both eyes is lower than they should be, minimal eyelid ptosis can be treated from the underside of the eyelid. I'll discuss this approach, which has been very successful for my patients with minimal ptosis and good levator function. I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery and a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. Eyelid ptosis correction is a specialized surgery not usually performed by general plastic surgeons who, during hospital-based residency, have limited exposure to cosmetic eyelid surgery, since Medicare does not pay for cosmetic surgery training, nor is ptosis surgery part of the core competency requirements of plastic surgery residency. Oculoplastic or oculofacial plastic surgeons like myself are trained in fellowships after residency training in ophthalmology to perform cosmetic eyelid and facial surgery as well as ptosis surgery. As I mentioned earlier, ptosis management is determined by the eyelid position and the levator muscle's function. The diagnosis of mild ptosis is based on the position of the eyelid margin relative to the pupil or central area of the eye. In our field, we'd say it's about 2 millimeters of ptosis, or 2 millimeters below the normal position of the upper eyelid margin. This normal position is about 2 millimeters below the upper edge of the iris, or the colored part of the eye. Practically speaking, the upper eyelid is lower than it should be and is also above the pupil. The treatment of ptosis begins with recognizing its presence. For example, if a patient has heavy upper eyelids, the low position may be attributed to the physical weight of the skin and fat, what is referred to as mechanical ptosis. In order to determine if there is ptosis independent of the weight of the upper eyelid tissue, I manually elevate the brows and see if the eyelids remain low. If they are drooping, this means that a ptosis surgical procedure should be considered. A proper ptosis examination involves assessing the eyelid height, levator muscle function, and several other important variables. Once the diagnosis of mild ptosis with good levator function is established, the procedure I usually perform is from the underside of the eyelid, called a Mueller's muscle resection. Mueller's muscle is located on the underside of the levator muscle. In my experience, addressing ptosis in combination with cosmetic eyelid surgery is very effective in making the eyes look much brighter. I routinely perform my eyelid procedures in my office operating facilities under local anesthesia with light IV sedation. My patients appreciate the convenience and avoiding common side effects of general anesthesia, such as a prolonged recovery, nausea and vomiting, and other issues. Our eyelid surgery patients generally return to work in about a week. I hope you found this information from my experience helpful. If you're interested in recommendations for your individual situations, you may contact us through our websites or call our offices to schedule a consultation. Thank you.